I'm 17 years old, and Madison College is a great way for me to kickstart my career. I'm actually super excited that my classes are online. I really enjoy online learning. With the support you get from Madison College and your teachers, the teachers are still genuine. You still get their support through your emails. If you don't understand something, you just contact them, and they really help you out and support you.
Good afternoon, ladies and gentlemen. This is Robert Chapo, Executive Editor, Madison365, with your daily news update for Friday, August 21st. Today, the news on the coronavirus situation, not the best. Not the worst either, but not great today. As we go along here, any questions, feel free to drop them in the comments. And we will get to questions at the end. I'm going to get through the statistics today, and then we will get into questions. Then I got a couple other newsy items to talk about. The coronavirus news, as I said, not the greatest. The positive test rate went up just slightly to 7.8%. We'd rather that go down, obviously. Especially, we'd like that to go down because we have more tests today. This is the first time since Saturday that we actually processed more than 10,000 tests for the day, which is good. We'd like to see that. We want to see those tests be more than 12,000 or so. That said, that's about 1,000 tests more than we had yesterday. But we'd like to see when the number of tests go up, you'd like to see the percentage of those tests coming back positive to go down. Right? Ideally, if you're doing more tests, more of them would be negative because you're testing more people who aren't at high risk. So the percentage of those come back positive would go down. That would be the ideal situation. Unfortunately, you would expect either way. If you do more tests, you'd have more positive results. But you expect the percentage of those coming back positive to go down. So we did have the tests went up. We did have more cases today, 826 new cases, 826 new cases. But the percentage of positive actually went up also, 7.8. Total cases now 69,059. So we'll very likely be past 70,000 over the weekend. As I mentioned, it was the first time since Saturday we have more than 10,000 tests. But one piece of good news, only 7,600 of those positive cases are considered active, meaning that they've been diagnosed in the past 30 days or still have symptoms or are still hospitalized. That's 500 down from yesterday. That's great. I want to see that number continue to go down. That number was as low as 4,800 at one point and went all the way up to near 10,000. To have that sort of drifting back down to 7,600 is good news. We did have two more fatalities today, one in Milwaukee County, one in Outagamie County. There was one fatality that had been reported in Oconto County that apparently was an error and was taken out of the data. So the total death toll now is 1,068. Let's talk about averages for a minute, just because you can look at one day of data and it doesn't mean a lot without context. 7-day average of new cases is now 690. The 14-day average of new cases is 702. Those are both lower than they were yesterday, which is good. What's not so good is the percentage of positive tests over the past 7 days is 7.8%. And over the past 14 days is 7.4%, so that's going up. over the past week, which is not good. Both for the past 7 days and the past 14 days, we averaged 6 deaths per day. So to only have 2 deaths today, it's still 2 deaths. I mean, that's bad news, right? 2 people, 2 families have lost a loved one. But to have 2 deaths is lower than the average for the past 2 weeks, so that's at least going in the right direction. Local cases, 182 in Milwaukee County. Not quite as bad as yesterday. It was 222 yesterday. 10.38% of tests positive in Milwaukee County. Brown County, again, a little bit better today, 57 cases, but 10.4% positive there in Brown County. They had 2 days of very big numbers earlier this week in Brown County. Calumet County, 11 cases, 16% positive. That's, that Calumet County has been on this list for quite a while. Eau Claire County, 12 cases, 8.2% positives. Fond du Lac County, 24 cases, 15.5% positive. Jefferson County, 36 new cases, 16.4% positive. Marinette County, 12 new cases, also 16.4% positive. Oconto County, 14 cases, 19% positive. Portage County, 10 cases, 15.4% positive. Sauk County, 13 cases, 15% positive, which is pretty high for them. Sheboygan County, 14 cases, 10.8% positive. Walworth County, which has also been on this list for a while now, 27 cases, 17% positive. Waukesha County, 75 new cases, 9% positive there. A couple other spots where the percentages are lower. Dane County today, 43 cases, 4% positive, 4.1% positive, which sounds good, but is actually high for Dane County. Dane County's usually been in the 1.5% to 2% range. Dodge County, 11 cases, 5.4% positive, so not bad. Rock County, 21 cases, 6.7% positive. Racine County, 32 cases, 5% positive, so not bad for Racine. Washington County, 46 cases, 6.8% positive, so that's a little bit on the high side, but lower than the state average. And then Winnebago County, 14 cases, 4.8% positives. Hospitalizations are down a bit. We're at 350 right now, people currently hospitalized. That's 17 fewer than yesterday, which is good, but that's also 14 more than a week ago. So that's been fluctuating quite a bit. Of those, 119 are in intensive care units. One additional thing I'll say about hospitals is you might remember a month ago, maybe. Yeah, right about a month ago. The federal government asked hospitals to begin reporting to the Department of Health and Human Services instead of the CDC, the Center for Disease Control. And that caused us to lose access to that data for about 2 weeks as they were reconfiguring something. I don't know what exactly. But the federal government wanted it in a different form or different something in some way. So they just didn't give us data for about 2 weeks. And now predictably, the federal government is saying the Health and Human Services can't handle this data, so please send it back to the CDC now, which is frustrating and a little bit funny, and a little bit just, predictable, of course. So we'll see if that then knocks that data off again for a couple weeks while they reconfigure it back or whatever. But anyway, hospitalizations, the number itself here in Wisconsin, it's fine. We're well below capacity levels, and it's lower than it has been, lower than it could be. So that's why we like to keep track of it, just so we know sort of how we're doing. in terms of the severity of the illness statewide. So it's good that that's low. That's remained relatively steady in the mid 300s. Um, Racial disparities: 13.4% of today's new cases are Latino, so that's about double their proportion to the population, and about 22% of the total cases. 14% of all cases are Black, who also make up only 6% of the state's population, and about 20% of deaths are still Black, which is, if you get COVID and you're Black, you're 3 times as likely to die from it than other races, which is bad. Rate of transmission today, still over 1. It's slightly lower. It's 1.07. Again, what that means is on average, each person who's infected passes it on to 1.07 other people. Easier way to think about that is to scale it up and say, for every 100 people who are sick, they will pass it on to 107 people. So now you have 207 people who are sick. And the second round of infection is larger than the first round. And the third round will be larger than the second round. And the thing will continue to spread. So that's not great. Even though our day-to-day numbers are not bad, the data indicate that the spread is actually accelerating just slightly. We like to say that below 1 so that we'll know then that it's actually contracting and each round of infection is getting smaller. But again, that also speaks to the need for increased testing. That if the data indicate that the virus is spreading and our positive case numbers are not growing significantly, that means there's a lot of people who are getting sick that we're not catching, that we're not getting tested. So I urge you, just as a citizen, sort of, to view getting tested as kind of a civic duty, even if you're not sick. We need to know who is, right? So even if there's any chance that you might be, and let's face it, anybody, 99% of the population of Wisconsin is still vulnerable. We need to be getting tested, even if we don't feel sick. So, okay, that's basically the stats on coronavirus. Paula asks, what is transmission rate? That's transmission rate. Rate of transmission is what I was just talking about. It's 1.07 right now for the state of Wisconsin. What that means is that's the average number of people who get infected by each infected person. So if the transmission rate is 2.0, each person who's sick, on average, will pass it on to 2 other people, who will then pass it on to 2 more people. And every round of infection will get twice as big as the previous round. So now that is 1.07, that means that every 100 people who get sick will pass it on to 107 other people, who will then pass it on to about 209 more people. 210, I guess. So each round of infection gets larger and larger and larger, and it spreads faster than it contracts. 1.2 is very bad. We were as high as 1.35 at one point. Actually, we were as high as 2.5 at one point. Back in March, before we knew anything about this, when this whole thing was just breaking, Wisconsin was like a 2.5%. Earlier in July, I think it was in July, we were the highest in the nation at 1.35. Once you get past 1.2, 1.3, you get into the point where it's going to get out of control real quick. So to be at 1.07, it's not good. Could be worse. Is basically what that is. Hope that makes sense. Corey says, we looked at the hospital data yesterday, which at the link I provided. Surprised at the number of people on respirators. I mistakenly thought anyone on respirator would be in ICU. So I take it you mean that there are more people on respirators than you expected. That is a little bit misleading because if it used to be the case, and I'm assuming it still is, I don't have any indication that this has changed. But what that's listing is the total number of people who are on ventilators for any reason. Because what it's showing you is the number of mechanical ventilators that are available. That's the reason they include that stat regarding people on ventilators. So those people who are on ventilators are not just coronavirus patients. Those are people who have other respiratory issues as well as coronavirus patients. The ICU number is only coronavirus patients. So it's possible, it's probable, that some of those ventilator patients are also in ICU with bacterial pneumonia, right? Or COPD or other things. They are on a ventilator and in an ICU, and they're showing up in the coronavirus ICU number, but not the coronavirus ventilator number or whatever. Or other way around. They're showing up in that overall ventilator number, but they're not showing up in the coronavirus ICU number. I hope that made sense. Yeah, Corey. Corey says, I thought from how it showed it was only COVID-19. We thought that too for a long time, and we were like really thrown off by it for like the first month and a half of this whole crisis. We really thought, I was like, there's so many people on ventilators. But I inquired, and that's what they told us. Tim Metcalf says Google Public Forecast still predicts another 15,000 cases and another 88 deaths in the next 14 days for Wisconsin, which actually would be pretty good. Let me see, the past 14 days we have had 72 deaths in the past 14 days. And we've had, let's see if I can do some math real quick. I mentioned before I'm an English major, so I don't do math on the fly. We've had 9,800 new cases in the past 14 days. So the next 14 days, well, and it's not actually the next 14 days. It's August 15th through September 1st. So we're already, 6 days into that period. So for any 2-week period, if we're fewer than 90 deaths, we're doing okay. It sounds like a lot. It sounds like 88 deaths sounds like a lot. But that's a daily average of 6.3 deaths per day. And we're at about 6 right now. So what that means is for the second half of August wouldn't be any worse than the first half of August. It wouldn't be a lot better. It would be nice if we're actually improving over the course of that period. At 15,000 new cases is about 1,000 cases a day, which would be worse, which it looks to me like that projection is going to be high. That just the past, since August 15th, we just haven't been seeing those 1,000 case days the way we did in the first half of the month. Now, the other thing I'll say is that the last time we looked at that Google Public Forecast, which was for August 1st through the 14th, it was very close to accurate. It predicted 97 deaths, we had 91. It projected 15. It also projected 15,000 new cases, and we had about 13,000. It was slightly high. So I would expect that the 15,000. I would expect us to come in a little bit under 15,000 cases, and maybe just a tiny bit more than 88 deaths. But that Google Public Forecast has been pretty good. So thank you for sharing that, Tim. I hadn't looked to see that yet today. Okay, a couple other things of note. The UW Madison Smart Restart is getting a lot of conversation, a lot of discussion. They're trying to restart classes in person for some folks and not for other folks. And excuse me, a lot of students are not happy with it. Graduate students, especially. The Teaching Assistant Association is basically saying we don't want any in-person classes until Dane County has 0 cases for 14 days. Which that's really aggressive. That's going to be a while before we're at 0 for 14 days. And there are some sort of behind the scenes who are saying, like, we're going to start school and we're going to have to call it all back off again in a week. This is going to go like North Carolina did, where you get 150 cases in the first week and have to go all online anyway. So why don't we just go all online now? So there's a story on that on the website right now. Our reporter Shazad talked to about 6 students and just got a variety of perspectives from those students. And then the other thing today is Tamia Folks, a reporter, spoke with Shannon Berry, who's the director of Domestic Abuse Intervention Services, about the sort of the increased need for domestic violence services. They actually went down early in the crisis as women and victims, children, were, and not all women obviously, but mostly women, were sort of trapped at home with abusers and unable to call for help if they needed it. But also at the same time, it's an economic crisis. Everybody's stressful. Everybody's frustrated. People are out of work. And in those circumstances, domestic violence typically goes up. So now that things have started to open up again, that's exactly what happened. That people started calling saying, I'm in a dangerous situation. I need to get out. And DAIS hasn't been able to do its normal fundraising. So it's short of funds to help people. So Tamia talked with Shannon about that. There's a story on the website right now on that issue. It's something you wouldn't necessarily think of immediately when you were talking about the pandemic, but it's definitely sort of another thing that results from the pandemic problem. That is most of the. That's more or less all the news. There's a few other news stories on the website at Madison365.org. Just take a look and get caught up there. It's a big weekend for soccer. The Europa League finals, UEFA Champions League finals on Sunday. Paris Saint-Germain from France versus Bayern from Germany. And Forward Madison is at home to Orlando City B, also on Sunday. So Sunday will be a sit in front of the TV and watch soccer day for me. I don't know about you. And that's about it. Subscribe to the podcast. Subscribe to Black Oxygen. Subscribe to Finding the Warmth of Our Sun. Subscribe to It's Only 10 Minutes. If you want all this good content in your earbuds, wherever you get your podcasts, you can subscribe to all those. Subscribe to Real Talk with Henry Sanders. You can get that interview with Carlton Jenkins. And then that show, Real Talk, is kind of on hiatus for the month of August, where we get caught up on some stuff, and we're going to ramp that back up in September. Will be pretty much daily interviews with leaders and people of color and sort of decision makers from across the state of Wisconsin. Once again, we are a free news outlet. We're a nonprofit. So if you want to support the work we do, just go to Madison365.org/donate. Other than that, have a wonderful weekend. I will be back here tomorrow, and enjoy your evening. Thanks for tuning in. Bye now.